The diagnosis and treatment of mental health illnesses has evolved greatly over time. From the first recorded definitions, mental health has been understood as a condition that can either be good or bad. One of the issues with this labeling of mental status is that in the act of categorizing states of mental health, good and bad, normal and abnormal, are disregarded as social constructs themselves. These terms are entirely defined by their social context, and their evolution has therefore not been a linear path. People with mental illnesses have historically been discriminated against, stigmatized, and ostracized from society due to the lack of adequate research and understanding of what mental health is and how to care for it. Yet, the evolution of psychological pathology has proven intentional research can lead to a deeper understanding of mental health. This deeper understanding has resulted in more ethical perspectives and treatment of mental illness. Over time, there have been three main approaches to the diagnosis of mental illness: supernatural, somatogenic, and psychogenic. Somatogenic means having a physical origin or cause, and psychogenic means having a psychological origin or cause. The following images will portray the general timeline of the diagnosis and treatment of mental illness. When the first signs of mental illness arose, the common theory of its origin was based in supernatural beliefs. Abnormalities in the brain were suspected to be caused by sources such as demonic possession, sins against the gods, curses, and more. This meant that treatment was often equally based in spirituality. Exorcisms and trephination were the most common forms of treatment and were often performed by religious figures of the church. Trephination is the boring of holes in the skull, a practice that was believed to release negative spirits or pressure from the brain. As these methods continued to be used, it became clear that they were not as effective as intended to be, and the supernatural explanations were slowly starting to be rejected. Intellects were developing new theories for the origin of mental illness and were predominantly somatogenic, meaning having to do with physical causes. This image shows an individual suffering from mental illness being subjected to an exorcism by a religious figure. Various sociological events, such as plagues and famine, have greatly impacted the development of mental illness research and treatment. This is one of the indicators for why mental illness pathology is more of a social construct than a concrete, objective occurrence. The position of mental illness was often manipulated by the society in which it was placed or found. So, despite new theories arising and being explored, supernatural attitudes towards mental illness were adopted again and led to the witch-hunting practices peaking between the 15th and 17th centuries. This image shows a woman accused of witchery about to be burned at the stake, although it is most likely she was struggling with some form of mental disorder and did not have the ill intent of witchery that she was being accused of. In the midst of the witch-hunting trials, around the beginning of the 16th century, the institutionalization movement was just getting started. Mental asylums and hospitals were being established across the country with the intent to protect the public from impoverished, mentally ill, unemployed, and criminal peoples. People were afraid of these populations because there was still no definitive explanation for mentally ill behaviors, and therefore were essentially seeking imprisonment methods so that the latter populations were removed from the general population. This image shows an example of the multiple records of patients within these asylums and hospitals being exhibited to the public as a source of entertainment. People would pay for tickets to come gape at patients in asylums and witness the separation of people with mental illnesses from the public. As word got out about the immoral treatment of asylum patients and the unsuitable living conditions they were placed in, a new movement occurred. This was the mental hygiene and deinstitutionalization movement. Protest against the inhumane living conditions and practices in mental hospitals became frequent occurrences, and there was a major shift in perspective of the patients in these institutions. Instead of being viewed as inmates, patients were now being viewed as guests. This wave of humanitarianism led to the establishment of community-based mental health services to replace the overcrowded mental institutions. In 1908, an individual by the name of Clifford Beers, who had gone through treatment at 3 separate mental institutions, wrote a book titled A Mind That Found Itself. This novel revolutionized the overall behaviors toward approaching mental illness research and treatment. Around the time of the release of Clifford's personal accounts of the mistreatment towards people with mental illness, the National Commission of Mental Hygiene and World Health Organization were established. This was the first marker of the mental hygiene movement. And as these collectives started to gain traction, so did preventative research. This initiative, in addition to the need to provide more efficient services for veterans in post-World War II America, led to the creation of the first diagnostic and statistical manual of mental disorders, also known as the DSM. This image shows an individual sitting in front of an informational poster encouraging people to consider mental health more seriously and ethically with the DSM by his side. The background is a series of images from a conference with President Jimmy Carter and others discussing deinstitutionalization. And finally, the emergence of various therapeutic approaches and medications. These approaches, such as psychotherapy and cognitive behavioral therapy, have been the most stable since their application and continue to be used in modern practices. Sigmund Freud's psychodynamic theory, the medical model of psychiatry, the cathartic method introduced by physician Joseph Breuer, and cognitive behavioral therapy, pioneered by psychologist Albert Ellis and psychiatrist Aaron T. Beck, are the leading theories and methods that build the foundation for psychotherapy. Psychotropic medications, such as Xanax and Zoloft, which are used to treat anxiety and depression, respectively, were discovered around the middle of the 20th century and became the dominant somatogenic treatment for mental illness. Pharmaceutical researchers were prescribing these medications because of their perception that mental illness was caused by chemical imbalances. Hence, these medications were intended to restore chemical balance in the brain. This image shows an individual receiving psychotherapy and being prescribed various medications by their psychiatrist in a modern setting. The inconsistency of treatment approaches, wavering back and forth between psychogenic, somatogenic, and supernatural, alongside the lack of clarity regarding the conceptualization of mental illness stigma, has certainly limited the aggregation of reliable scientific knowledge. Regardless of where the motivation was found in these psychological research endeavors, this historical perspective portrays how the approaches to mental illness were disassociated from the actual experiences of people living with mental illness. There were countless assumptions and inhumane experiments that could have been avoided if mental illness could have been understood as a fundamentally human phenomenon. According to a recent national study of the public opinions on mental illness, only 42% of Americans aged 18 to 24 believe people with mental illness can be successful at work. 26% believe that others have a caring attitude toward people with mental illness, and 25% believe that people with mental illnesses can recover from their illness. Manifesting at multiple levels, stigma is a social process that, based on certain contexts, influences the way people perceive others' conditions. These are the stigmatizers, and those who experience the discrimination are the stigmatized. Sociological and cultural factors have the most significant impact on people's conceptualizations and experiences of mental illness. And this is precisely why psychological pathology is, at its core, a social construct. The way we study, diagnose, and treat mental illness is entirely based on the context of the society and culture it is built and experienced in.